this morning I have a guest in the building, Dr. Opeyemi Taiwo Alabi. He is a consultant urologist, a visiting consultant urologist to Grandview Medical Center here in Lagos. He'll be joining me to dissect the topic we have for this morning, which is kidney stones, medically referred to as renal calculi. If you're talking about one stone, it becomes calculus, not the one for calculation and permutation. Okay, but when there are many, calculi, okay? Now, if the kidney stones are found in the kidney, within the substance of the kidney, they are called renal stones or renal calculi. However, if they are found in the ureter, it becomes ureterolithiasis, stones within the ureters. First of all, let's start with the anatomy of the kidney. What is the kidney? Many of us may not know what the kidney is, okay? Kidneys, ideally, every individual should have 2 kidneys. Not everybody actually have. Some were born with just 1 kidney. Okay, but that's not our topic for today. So they are fist-sized, bean-shaped organs that are found within the abdomen, usually behind the major organs of the body, the liver in the right, the stomach in the left, pancreas, and others. They are found on either side of the spine. That's the backbone. Now, what is the major function or the functions of the kidney in the body? The one that everybody can remember and are conversant with is the fact that kidneys remove waste products, toxins, from the human body in form of urine. Okay? That's a major one. But there are some other ones that I would also like to mention. Kidney plays a role in the control of the acid-base balance in the human body. It plays a role in the control of water balance, plays a role in the maintenance of electrolytes in the body, and of course, produces a very important hormone that takes part in the production of red blood cells, erythropoietin, among many other hormones. These are some of the functions of the kidney in the human body. But this morning, our emphasis will be on kidney stones, renal calculi. What causes them? What are the risk factors? How do they present? Many of us may not know that kidney stones have various or different types that are caused by different things. And of course, the treatment cannot be a one-size-fits-all, as some of us may want to believe. And this morning, we have an expert in the building who will be talking to us on what we need to know about kidney stones. And I would like to yield the floor to Dr. Opeyemi Alabi. You're welcome to the show, sir.
Thank you so much. Thank you for inviting me.
Yeah, thank you.
It's a great privilege.
And of course, we've been here plenty of times.
There is always that nostalgia.
Yes.
You know, it's always a pleasure to be here and to share some of my thoughts and knowledge about burning health issues. So before I proceed to the meat of our discussion today, I would like to issue a disclaimer that this is essentially for public health enlightenment.
Yes.
It's not intended for personal advertisement of my competence or Grandview Medical Laser. And I also want to emphasize that, online, on various social media, there are people who we've treated, who fall in love with us, and then who might make comments and might use superlative words. It was not, does not originate from us, and we don't take responsibility for that. So having said all that, I would like to go into the meat of the of our discussion, which is renal calculus, or calculi, if it is there are more than one. You see, kidney stone is a very important health problem, disease of the kidney, and it's very expensive to treat kidney stones. Very expensive and very costly for the patient in terms of time off work due to pain, due to complications of kidney stones, and also in terms of the fund that is used to treat kidney stones. So it is very important to emphasize on how kidney stone, occur and how to prevent them. Because prevention, it's one of the diseases that actually typifies that idea that prevention is better than cure.
Yes.
Okay, because it's very, very expensive to treat kidney stones. And more often than not, once you have kidney stone once, you are likely to have it again. Okay? As a matter of fact, about 50% of patients who develop kidney stones would have it again within the next 5 to 10 years. So it is better not to even have it at all. Okay, so the emphasis of my discussion will be on prevention of kidney stones, the pathophysiology of kidney stones, and the prevention of kidney stones. Because once you form kidney stones, you become my patient. And by the time you become my patient, then you have already missed it. Okay, and it's a very expensive disease to treat. Okay, so having said all that, you see, stones, I get the question a lot from patients, whether it's the same stone that will pick on the floor. It is not the same stone. But you see, the stone on the floor also has calcium, maybe calcium carbonate. The geologist will give you a better picture about that. But the stone within the urinary tract also has calcium, okay? And it's also hard. You can't pinch and break it. Sometimes you require something as hard as hammer to break it, okay? So it's very hard, it's rich in calcium, and it is formed from crystallization of ions, normally occurring ions within the urine, okay? So that brings me to establishing the background of kidney stone. So, and I would like to do that by, first of all, giving you the understanding of the urinary tract. The urinary tract comprises of the kidney, the ureter, the bladder, the prostate, okay, with the urethra passing through the prostate, then through the penis in male. Whereas in female, you don't have prostate, and then you just have a very short urethra from the bladder. Okay, so if we start from the kidney has the flesh and spaces.
That's a picture that we have on our screen.
That's a picture of the kidney. The kidney has flesh and spaces. That's the in layman's language. The flesh.
The picture we have is for a male.
Yes. So the kidney, for layman understanding, it has the flesh and the spaces. The flesh produces. Yes. The flesh produces the urine. So when the urine is produced, it enters the spaces. The spaces within the kidney, they are called the pelvic calyceal system. Okay? So when the urine is produced, it is passed into the pelvic calyceal system, and from there, it is passed down through that narrow tube into the bladder, where it is stored temporarily before it is then expelled through the urethra outside. So when you have that basic understanding, it will give you a background of why formation of stone within this tract becomes important, and it becomes a major health issue, and the sequelae of formation of stone, which are capable of obstructing the flow of urine along this tract. Okay? So, when stones are formed, you see, the way God has structured the constitution of the urine is that every human has all these constituents that form stone in their urine. But if you eat healthy, you live healthy, you will not form stones. And the reason is because there are things that are within the urine that are natural inhibitors of stone formation. Okay? On the other hand, there are things we get ourselves exposed to, either by our lifestyle, by our eating habits, and also by exposure to toxins, that promotes stone formation. So it is a balance between the promotion and inhibition of stone that keeps us at equilibrium. So if you have more of inhibitors of stone within your urine, you aren't going to form kidney stone. As against, if you have more of promoters of stones, then you will form kidney stones. Okay?
So in a way, a layman will understand what are the major causes of kidney stones in the body.
Okay, so the major causes of kidney stones it's boiled down to the promoters.
Or can we call them risk factors?
Yes, risk factors. You see, the risk factors generally, age is a risk factor, because you see, stones rarely forms in people less than 20 years, although stone can form in, across age group.
Okay.
Infants can form stones.
Okay.
Stones have been reported in children, neonates.
Cystine stones and
You understand?
all that.
And all that. So in children, children as young as 9 months, and it can occur at any age. Okay? But the peak age incidence of stone is between the 4th and 6th decade of life. Okay, so age, yes, a risk factor.
Okay, family
Then,
history, does it play a role?
Hereditary,
Okay.
genetics plays a role. If you have family history of stone, then you can form stones.
So in other words, we have modifiable risk factors and
Yes.
non-modifiable risk factors, even for stone formation.
Yes. So then you also have, it's also commoner in male.
Why?
Okay,
Why is this so, sir?
Because in female, estrogen is protective. Okay, it's anti-stone. So in female below the age of menopause, that is when they have a lot of estrogen within them, estrogen is protective. The incidence of stone is lower. But after menopause, it's almost equal with men.
Okay.
So then things like obesity comes in. Okay, so obesity, that is excessive weight gain, increase in body fat,
high
body weight.
mass index.
Okay, when people begin to have increased weight on their torso and all that. Having said that, obesity has been implicated in so many things: heart disease, stroke, cancers, and all that. It's also coming up with stones. Okay, so, and that speaks to the need to avoid obesity, to ensure that we keep fit and exercise. So that also comes to another risk factor: inadequate exercise. Okay, and that has to be addressed with a balance, okay? Because, you see, when you exercise is good. It helps you to lose weight. It helps to prevent obesity. And also, it helps you to sweat out. And when you sweat out, you have to drink more water. Yes. And when you drink more water, it invigorates your system. It flushes out all those solutes that might accumulate within your urine and leads to stone formation. Okay, so that is so much for exercise. And also, you see, lifestyle modification also, lifestyle modification is very important. Then also, the geographical, the geographical location.
Yes.
And that is why you find stone commoner in the northern part of Nigeria.
It's
and
harsh
also
climatic conditions.
Yes, hot weather, and also during the dry season, you tend to see patients coming down with more stones.
So in other words, people who live in that part of the world should drink and
they should drink
plenty
more
of water.
And also, not that alone, when you live in big cities like Lagos, okay, it has been shown that the temperature in big cities is about 1 to 3 degrees Celsius higher than people living in the village, in the rural areas. Okay, so when you live in big cities like Lagos, you need to take a lot of water because the temperature is high. Okay, and when that happens, you see, and that's why we talk to patients that you should take a minimum of 2 to 3 liters of water. How did we arrive at that? Because you see, as we're talking, as you are sweating, you lose about 1.5 liters.
Yes, let me stop you a bit. When we say 2 to 3 liters, let me bring the message home. Okay, those of us who live in Nigeria can appreciate it. A liter of water contains 1,000 mils. Okay, so if you have 2 sachets of pure water combined, that will give you a liter of water. Each sachet of pure water is about 500 mils.
Exactly.
Okay, so if you have 2 combined, that will give you a liter of water. So if we say 2 liters, we are talking about like 4 sachets of pure water. If we say 3 liters, we are talking about 6. So that gives you an idea of the volume. But when we say liters, not everybody can appreciate it. Go on, my chief.
Thank you so much. I appreciate that. That is more practical.
Yes.
Okay. So you need to take like about 3 liters. How did we arrive at that? From talking and from sweating, you lose about 1.5 liters. Then from urine,
you a bit. Stanley from River State.
Can one survive with one kidney? How safe is the person living with one kidney?
Okay, thank you very much. Can someone survive with one kidney? The answer is yes. As a matter of fact, a good number of us a handful of us in a number of communities. We have Eze from Abuja. We will come back to your question. Eze, good morning.
Yeah, good morning, sir.
Yeah, how are you today?
I'm fine, sir.
Yeah, thank you. Happy New Year.
I wish you the best, sir.
Okay, so go ahead with your contribution or question.
Yes, I have a question for the doctor in the house.
Okay, go ahead. He's listening to you.
So, is there any relationship between kidney stone formation and cholesterol?
Okay.
Blood cholesterol.
Okay, thank you very much. I would like him to take the question.
Okay,
thank you very much for calling in.
So, thank you, Mr. Eze. Kidney stone and cholesterol are linked to the extent that, you see, for you to have excessive cholesterol, sometimes that means you're having issues with your dietary intake of either excessive carbo, which gets eventually converted to fat and all that, or you are actually taking even too much of fat, and that can lead to obesity. So that definitely will be a link. But when you just talk about hypercholesterolemia without obesity, because that also happens, some people just have deranged blood lipids. So that really might not have a direct correlation. But there could be a correlation to the extent that, when you are obese, you have issues with blood lipids, cholesterol, and all that, and that can predispose you to stone formation. So let me address the first question also.
Yes.
That
Can somebody
was
survive
asked.
with one kidney?
Can somebody survive with one kidney? Yes, pretty much. You can survive with one kidney, but when you have one kidney, it places a responsibility of caution and care on you. Okay? You have to be very cautious. Okay? The God that put the two kidneys there, has a reason for doing that. So it's so that one can be able to take over if the other has problem. Okay? And sometimes people have a kidney stone on one side that has damaged that kidney, so the other kidney takes over. So when you have one kidney, you must be very careful, be health conscious, okay? You must drink a lot of water. You must avoid chemicals, creams, mercurial creams that are toxic to the kidney. If you have diarrhea, vomiting, and all that, you present early to the hospital so that you don't have...
Good morning.
Good morning, my brother.
Please go ahead. We'll come back to that, sir.
Okay. Hello?
Go ahead. We can hear you. You're on now.
Yes, please. I actually want to know if there a particular food that one eats that can actually result into these kidney stones.
Okay, good. Good. You'll hear about that, okay? We'll take your question. But before we go to your question, I would like to allow Doctor to finish the question he was trying to answer on the question that the first caller asked, if someone can survive with one kidney.
Yes, so I was saying that you can survive on one kidney, but you must be very cautious. You must not abuse analgesics. Those analgesics we call NSAIDs. You can't abuse them because they can damage your kidney. You must not abuse concoctions, okay? Herbal concoctions, you must not abuse them. You must not use them at all, okay? So when you have issues with vomiting, diarrhea, you must go to the hospital immediately so that you can get rehydrated and you can, things that could lead to kidney injury can be prevented, okay? So that I can replace the electrolytes you lose in the process, okay? So you can survive with one kidney. And as a matter of fact, when people have kidney failure, end-stage kidney diseases, we transplant just one kidney to them,
Exactly.
okay? Because the person that is donating the kidney cannot give you two. It gives you one, and that one is what we transplant to the patient. And for many of them, it helps them for several years. So you can survive with one kidney.
Thank you
but
very much.
It places a responsibility on you too.
Thank you very much. Additionally, because he may be asking that question from another angle. Additionally, one can be born, a human being can be born with one kidney in a condition known as renal agenesis. Okay, so someone can be born with one kidney, and some of us who may be born with one kidney may not be in the know. Sometimes it's discovered as form of accidental finding, probably when you send a person to go and do an ultrasound scan. Okay, in some situations you could have two kidneys, but only one could be functional. Okay, renal dysplasia, that can happen. You can also lose one to cancer or some other disease conditions, okay, other than doing transplant like he has explained. Okay, I think one of the popes that is late now was actually discovered to have been born with one kidney. So someone can survive with one kidney. Okay, so someone asked a question on diet. Are there foods that can promote the formation of kidney stones? Okay, so let me also add another one to it. Are there food that can prevent the formation of kidney stones, so that we can take that on diet, sir?
Yes, okay, so that brings us to dietary modifications. Food, yes.
Okay, so we have Obia from Ebony. I think he has called before. Good morning. Good morning, sir.
Hello, good morning.
Yes, yes. You're on to Health Matter.
Okay. So actually, my question is, this is advice of water intake. Hello, can you hear me, sir?
Yes, we can hear you loud and clear.
Okay. My question is this water consumption that they say that it handles kidney issues. Is there any quantity of water that needs to be taken in order for it to be taken care of? And besides, when it is still at the primary level, the primary level I'm talking of is when it is still discovered that it is still very small, because I have a patient suffering it, a brother precisely. So when it is still very small and you are advised to be taking water, will it really handle it alongside with the medication alone, or does it require that one must undergo surgery? And besides, being a hypertensive patient, they were like advising that water therapy is not all that advisable. The water therapy is so much water consumption to the system. So I really want to be advised. Thank you.
Okay, thank you very much for that very important question. I will allow the urologist to take your question.
So thank you for those questions. And water therapy is in fact is the bedrock of all stone prevention modalities. All stone prevention protocol has water as their bedrock. Okay, so just to also tell you that no matter the amount of water you take, there's no amount of water you take that is going to worsen your hypertension. Rather, what you should be careful of if you have hypertension is salt. Okay, salt. You should reduce your salt intake, most especially in this environment. Hypertension is volume-based and also salt-based. Okay, so you should limit your salt intake. So the recommended quantity of water you should take daily is 3 liters. And I explained the other time how we arrived at that. You lose about 1.7 liters in the urine, another 1.5 liters from talking and from sweating. So that brings it to 3.2 liters. And you also produce, you lose 200 mils also from feces. So when you now combine the one that is formed endogenously, which is about 200 mils, and you deduct it, you have 3 liters. And that's how we arrive at that. So if you are exposed to heat, okay, if you are working in an industry where you lose a lot of heat, where a lot of heat is being generated, and you lose a lot of water,
that has areas that have harsh climatic conditions.
Yes, you have to drink more. You may even require to drink more than 3 liters. If you work in a factory environment that is very hot and then you sweat a lot, you might even need to drink more. Okay? So water is the bedrock of all stone prevention protocol.
Thank you very much. Additionally, there are some medical conditions that one may have and your doctor may ask you to limit the quantity of water you will take, particularly people who have some form of kidney pathologies. I must also point that out. Okay, so if your doctor does not advise against that, you are at liberty, okay, to drink with respect to the recommended, depending on your situation. Okay, thank you very much. Now, Chief, let me take you to signs and symptoms of kidney stones. So oftentimes I've heard about colleagues making a diagnosis of appendicitis, acute appendicitis, when someone actually has a kidney stone. What are the signs and symptoms of kidney stone? What should we look out for?
All right, thank you. So that also brings me to the question that somebody asked the other time, that his brother had a stone and it was water therapy was recommended for him. You see, people recommend water therapy when the stone is small, okay? Usually when you have stones that is smaller than 4 millimeters, okay, just about the the head of a pin, okay, just there at a location within the urinary tract where it is not obstructing the flow of the urine. Okay, so such stone can be managed conservatively. What water would do essentially is to prevent formation of further stones, okay, and also the one that has been formed, it can help to dislodge it, and then it can be passed.
Let me pause you a little. Chinyere from Anambra, good morning. Yes, good morning. Can you lower down the volume of your TV set so that we can hear you loud and clear?
Good morning, sir.
Yeah, good morning, Chinyere, Madam Chinyere. Okay, go ahead with your contribution.
Yes, George, I want to ask you a question, sir.
Yes, go ahead.
What is the causes of this kidney? What can cause that kidney problem? This kidney stone?
Okay, what can cause kidney stones?
Yeah, I want to know.
Okay, thank you very much. Listen, doctor will take that question once more.
So, you know, inadequate intake of water is a major cause of kidney stone. And I want to tell you that if you take a lot of water, you are likely not to form stones. Because, you see,
so in other words, dehydration is
a key.
Okay.
Is a major cause of stone formation. Okay? So because, and what we tell patients who have formed stones before is, if you go to the loo and you pee and your urine is not clear, you're already setting yourself up for another stone formation, even if you embraced all those lifestyle modifications. And so sometimes even exercise can be counterproductive in stone formation, because when you exercise too much strenuously and you sweat a lot and you don't replenish your body with adequate intake of water, you get dehydrated, your urine gets concentrated, and you can form stones. So balance has to be struck
yes,
when it comes to exercise. So talking about diet, you know, the earlier video has done a lot of justice to that.
Yes.
Okay? The things that cause stone are, the promoters of stones are calcium, oxalates, and salts, and sodium.
Yes.
Those are the promoters of stone. So if you want to prevent stone formation, in addition to taking enough water, you have to limit salt intake.
Do less of animal protein, less of meat,
Yes.
and more of legumes.
You reduce salt intake and also oxalate intake. And the major source of oxalates is animal protein.
Chief, what are the different types of stones that can be formed in the human body? I'm not talking about igneous rock now. Okay,
so, you see, by far the commonest type of stone is calcium oxalate stones.
Okay.
Okay? Calcium oxalate. Calcium, let's just say calcium containing stones.
Okay. Because there's also calcium phosphate
there
stones.
is calcium oxalate, which is by far the commonest, and also calcium phosphate.
Okay.
Okay? So, the other forms of stone are uric acid stones, struvite stones, which is like an infective stones, which contains magnesium, ammonium phosphate. Okay?
So, throw more light on that. You say it's like an infective stone. Does it have to do with infection?
Yes.
UTI, recurrent
Yes.
UTI.
Recurrent urinary tract infection.
Okay.
Because you see, the infection of the urinary tract, the organisms that are involved, they produce urease, which splits urea into ammonium and water. Urea splitting organism, they contain urea. So when they split into that, they also create an environment that is conducive for stone formation.
Okay, so now you
for
know.
the precipitation of magnesium, ammonium, and phosphate.
So having recurrent urinary tract infection can be a nidus, can create the enabling environment for a type of stone to form. Okay? And there are some others. Yes.
Yeah, the last one is the cystine stone. Okay? And that is usually from inborn error.
Oseni from Abuja. 1 minute, sir. Oseni from Abuja. Good morning, sir.
Good morning.
Yeah, how are you today?
Fine.
Okay, please go ahead with your contribution.
I called to say a very good thanks to this program because I'm listening to it and I'm happy about it.
Thank you, sir. We appreciate you.
Thank you.
Thank you very much.
So, like I said, cystine stones are usually due to inborn errors of metabolism.
And these are usually the types that can be found in children.
And it represents about 25% of urinary tract stones in children, kidney stones in children. Okay, so once a patient forms stones, like I was telling you, that ordinarily my emphasis would have just been on prevention of stone, because once you form stones and you end up in my consulting room, you have already...
So what are the signs and symptoms that the patient will need to watch out for?
So when, like I earlier said, most stones are asymptomatic when they are small. 3 millimeter stone in a place where it's not obstructing nothing.
Akim from Para. Akim, good morning, sir. Sorry, I'm stopping you, sir. Go ahead with your contribution.
Okay, I want to ask the doctor, how many, what's the liter of water we should be taking per day?
Okay. He has answered that a couple of times, but I would like him to repeat that again. What quantity of water, daily intake of water, what quantity should we go for?
Minimum 2 to 3 liters. 3 liters is a comfortable volume to take. You may need to take more if you work in factory where a lot of heat is being generated, or if you live in the far north where the temperature is more, because you're going to lose more water and you will need to replenish. So basically about 3 liters.
And if you do plenty of exercise. Okay.
So, and 3 liters, like Dr. Barth explained the other time, means about six sachets of pure water.
Okay.
Or if it's the big ever water, we are talking about 2, because each is 1.5 liters.
Yes.
So 2 of it makes, if it's a small one, we are talking about 4.
Thank you very much. Okay, so what he's trying to explain is in terms of what we can relate with here in Nigeria. Okay, a sachet of pure water is about 500 mils. So if you have 500 mils plus 500 mils, 2 sachets of pure water combined, you have 1,000 mils, which is equivalent to 1 liter. So if we are talking about 2 liters, we are looking at about 4 sachets, 3 liters to 6 sachets on a day, typically. But when you exercise, you need to take more. If you live in a very harsh climatic areas that have harsh climatic conditions, far north, you need to take more.
Live in Lagos?
You live in Lagos, you live in cities, you need to take more. Okay? Now, how do we make a diagnosis? Okay? I was going to ask, can people who have stone present with urinary symptoms? We have Celestina from Lagos. Good morning, Celestina.
Good morning.
Yeah. Please go ahead with your question or contribution.
Okay, my question goes like this. Talking about water therapy. Some do tell us that warm water is better than cold water. So I want the doctor to enlighten us more on that, please.
Thank you very much.
Over
to you, Chief.
Whether warm or cold, just
water,
drink water.
Or warm water is better than cold water for when you want to use it as water therapy.
You see, the temperature of the water does not matter. It's the quantity that matters, and also the type of water. You see, there are some kind of water we call hard water. That also can predispose to stone. We are talking about soft water, the common water that you find around. Okay, so minimum of 3 liters. So how do we? We're talking about the symptomatology of kidney stones, and I said bulk of them they are asymptomatic.
Yes,
and then, but majority of stones, significant stones, will present with pain. Flank pain. So the flank is the part of the body between the lowermost rib and your hip bone. Okay, this is the flank.
The space where he's touching now.
Okay, this is the flank. So most patients will feel pain along this area. Some of them, if the stone is in the ureter, they can feel it radiating towards the roots of their genitals. Okay? So, flank pain is perhaps the commonest presentation of stone. And why does kidney stone cause pain?
Can you also cause blood in urine?
Yes, we'll come to that. When you have a significant stone, it will obstruct the flow of urine from the kidney to the bladder. So when it obstructs it like that, there is a back pressure. Okay? The kidney, the ureter is contracting to empty urine into the bladder, but because of the obstruction, it's not able to do so. So that causes what we call colic, renal colic. Okay? So, and that is a very, very excruciating pain.
Pain that comes and goes.
Yes.
Waxes
it
and
waxes
and wanes.
And wanes. And it's
Like the labor
excruciating.
pains.
It's very excruciating. Okay, people who have experienced it before have described it as the worst pain they've ever had. Okay? So, pain is a major presentation and is by far the commonest presentation. So, some patients can come with bleeding, what we call hematuria. Okay? And I must also say that, sound a note of caution that when you have blood in the urine, it must be thoroughly investigated to be sure that it's not due to any other sinister cause or causes, which can be cancerous. So blood in the urine is a complete. Then recurrent fever, okay, is a prominent feature of patients who have stones obstructing the urinary tract, especially either an infundibulum of the kidney, of either upper, middle, or lower pole, or the neck of the kidney, which we call the PUJ, or the ureters, or even the urethra. Okay, when it obstructs like that, stone is not exactly sterile. Okay, so when there's obstruction, there's a damping back of potentially infective fluid within the system. So, and through that, the several channels, pylovenous, pilosebaceous, all those are very, very big terms. But the toxin can find its way into the blood and cause fever. Some patients have fever, chills and rigor, they'll be shaking.
Thank you very much.
Because of release of toxin into their blood.
Thank you very much, sir. Now, when we talk about urethra, people get confused. Okay, so let me clear the picture here. On either side of the spine, lower back, you have the two kidneys, usually a bean-shaped organ about the size of one's fist. Okay, so the tube that connects, that leaves the kidney, goes all the way to the bladder on one side, and there's another one that leaves the kidney, goes all the way, that tube where urine passes to get to the bladder, that is called ureters. However, from the bladder in males that crosses through the prostate, the substance of the penis, through which we pee, we urinate. Also for the females, that is urethra. So he has been mentioning that, okay, so the stones can be caught up in the ureters on either side, okay, of the body. That can happen as well.
And that is very significant because if you have stone simultaneously in the two ureters, it can cause renal failure, which can be a presentation of kidneys. I've seen patients presenting to me.
That one is wicked, like sir.
Yes. Doubly impacted stone at the ureters.
Wow.
Okay.
I'm afraid this is how much time can allow us for today. Hopefully, we'll be able to come back to talk more on prevention as well as treatment if time permits. I want to say a very big thank you to Dr. Opeyemi
Always
for coming.
Pleasure, sir.
You did a yeoman's job as always. And to our viewers at home, thank you very much. We'll see you again same time next week.